Describe yourself in one or three or five words.
Calm, adaptable, consistent, friendly, and professionalism.
How would others describe you?
If you asked my colleagues, they would describe me as reliable, disciplined, and safety-focused. In a medical surgical setting, they trust me to follow protocols strictly, maintain infection control standards, and anticipate patient and procedural needs. During surgeries and post-operative care, I am known for being well-prepared and attentive to detail, which helps ensure smooth workflows and patient safety. My friends and family would describe me as calm under pressure. This quality is especially important in medical surgical nursing, where patient conditions can change rapidly. In emergency or high-acuity situations, I remain focused, prioritize tasks effectively, and communicate clearly with a multidisciplinary team to support timely and safe patient care. My patients would describe me as observant, compassionate, and approachable. I closely monitor their condition, manage post-operative care such as wound care and pain control, and pay attention to their concerns about recovery and discharge. I make sure patients feel listened to, informed, and safe, which supports both physical healing and emotional comfort.
What has been your greatest achievement?
My greatest achievement as a nurse was demonstrating strong clinical judgment and patient advocacy during a high-risk surgical emergency. Rather than an award, it was a moment where my actions directly contributed to saving lives. During a Category 1 emergency cesarean section, the patient developed severe hemorrhage in a very tense and understaffed situation. Despite the urgency, I remained calm and focused on maintaining essential surgical safety standards. I ensured the WHO surgical safety checklist was completed and maintained accurate surgical counts throughout the procedure, even while the bleeding was ongoing. I also reinforced strict infection control practices to prevent post-operative complications. Because safety protocols were followed without compromise, the surgery was completed successfully, and both the mother and baby recovered well without post-operative issues. This experience remains my proudest achievement because it reinforced the core principle of medical surgical nursing, that patient safety, vigilance, and adherence to standards must never be sacrificed, even in emergencies. It confirmed my role as a patient advocate and a dependable member of the surgical team.
What was your biggest setback?
My biggest professional setback was experiencing a delay in progressing to an international medical surgical nursing role, despite being fully prepared in terms of qualifications and language requirements. It was challenging to be ready for the next step while external factors temporarily paused international recruitment. Instead of allowing this setback to discourage me, I used the time purposefully to strengthen my clinical practice. I focused on advancing my medical surgical skills, particularly in the operating theater, where I became more confident with complex procedures such as advanced laparoscopic setups and perioperative patient management. I also reinforced my commitment to global standards by consistently following WHO and national safety protocols in every aspect of care. During this period, I placed greater emphasis on patient education, post-operative monitoring, and discharge planning, ensuring patients clearly understood medication schedules, wound care, and follow-up instructions. This helped me grow into a more well-rounded and safety-focused medical surgical nurse. This setback taught me that while I cannot always control the timing of my career progression, I can control the quality of my practice. As a result, I am now a more experienced, confident, and patient-centered nurse, fully prepared to contribute effectively to an international medical surgical healthcare team.
What are your hobbies?
In my free time, I enjoy cooking as a way to relax and unwind. Preparing dishes at home allows me to be creative while still applying precision and attention to detail, qualities that are essential in medical, surgical nursing, and in the operating theater. Cooking helps me manage stress and maintain focus, which supports my performance at work. I also enjoy traveling and exploring new places. Experiencing different cultures has helped me become more open-minded and empathetic, which is especially important when caring for patients from diverse backgrounds in a medical surgical setting. It improves my ability to communicate effectively and provide patient-centered care. After long or demanding shifts, I enjoy watching movies as a way to recharge mentally. Maintaining these hobbies helps me achieve a healthy work-life balance, allowing me to return to work refreshed, focused, and ready to provide safe, high-quality care to my patients.
What is your ideal job?
In my free time, I enjoy cooking as a way to relax and unwind. Preparing dishes at home allows me to be creative while still applying precision and attention to detail, qualities that are essential in medical, surgical nursing, and in the operating theater. Cooking helps me manage stress and maintain focus, which supports my performance at work. I also enjoy traveling and exploring new places. Experiencing different cultures has helped me become more open-minded and empathetic, which is especially important when caring for patients from diverse backgrounds in a medical surgical setting. It improves my ability to communicate effectively and provide patient-centered care. After long or demanding shifts, I enjoy watching movies as a way to recharge mentally. Maintaining these hobbies helps me achieve a healthy work-life balance, allowing me to return to work refreshed, focused, and ready to provide safe, high-quality care to my patients.
Why you should hire me.
You should hire me because I combine strong medical, surgical technical skills with a calm, safety-driven approach to patient care. My experience as a scrub nurse has trained me to maintain the highest standards of sterile technique, infection control, and surgical safety in fast-paced operating environments. I am not only task-focused but proactive, anticipating surgical needs and supporting the team to ensure procedures run smoothly and safely. Patient safety is always my top priority. I am meticulous with surgical counts, aseptic practices, and perioperative care, and I consistently use structured communication tools such as SBAR and the WHO Surgical Safety Checklist. These practices allow me to deliver coordinated, error-free care from preoperative preparation through postoperative recovery. I am also adaptable and committed to continuous professional development. During a period when international opportunities were delayed, I used the time to strengthen my clinical skills, learn advanced surgical techniques, and improve my professional communication. As a result, I am confident, disciplined, and ready to integrate quickly into a high-standard medical surgical team. My calm manner during emergencies helps maintain focus, efficiency, and patient safety when it matters most.
Describe a situation where you led a team.
I demonstrated leadership during a particularly demanding period when our operating theater experienced an unexpected staff shortage combined with a high surgical workload. Several complex cases were scheduled on the same day, including emergency and elective procedures, which required strong coordination to maintain patient safety and workflow. I stepped forward to support the team by organizing staff allocation based on skill mix and case complexity. Experienced scrub nurses were assigned to high-risk procedures, while junior nurses were paired with senior staff for supervision and learning. I ensured all surgical instruments, implants, and specialized equipment were checked and prepared in advance by coordinating closely with the CSSD and biomedical teams. Throughout the shift, I acted as the main point of communication between surgeons, anesthetists, nursing staff, and support services. When priorities changed due to an emergency case, I helped reorganize the theater list efficiently while keeping all team members informed. I also maintained strict adherence to the WHO Surgical Safety Checklist and infection control standards despite the increased pressure. As a result, all surgeries were completed safely without delays or complications. This experience taught me that effective leadership in medical, surgical nursing requires calm decision-making, clear communication, teamwork, and a constant focus on patient safety.
How do you define success?
For me, success in nursing is not defined by a single outcome, but by consistently delivering safe, high-quality care at every stage of the patient journey. It means performing each clinical task accurately, following evidence-based protocols, and ensuring that documentation and communication are completed to the highest standard to protect patient safety. I experienced this clearly during an emergency neurosurgical procedure. The patient required immediate intervention, and I had to coordinate rapidly with the surgical and anesthesia teams while preparing specialized instruments and implants under time pressure. In that moment, success meant remaining calm, strictly adhering to the WHO Surgical Safety Checklist, and maintaining precise surgical counts to prevent any avoidable harm. Equally important was what happened after the procedure. I ensured that all intraoperative details, medications, and wound care instructions were fully and accurately documented. I then provided a structured handover to the recovery team using the ISBAR framework, clearly explaining the procedure, potential risks, and ongoing care requirements. I defined success as the ability to combine clinical excellence, clear communication, and professional resilience, so that every patient receives safe, continuous, and compassionate care, even in the most demanding situations.
Tell me one thing you would change about your last job.
One area I would have improved in my previous role was the system used to track surgical supplies and implants. In a high-volume operating theater, inventory was managed manually, which became challenging during emergency procedures when time was critical and pressure was high. Rather than viewing this as a limitation, I treated it as an opportunity to contribute to quality improvement. I participated in clinical audits and completed additional training related to safety standards and effective communication. Working closely with senior nurses and theater technicians, I helped strengthen our documentation process by ensuring that all implants, instruments, and medications were recorded immediately and accurately during procedures. We also refined our surgical checklists and ordering practices, which reduced time spent on post-operative reconciliation and improved workflow efficiency. These changes supported accurate surgical counts, reduced the risk of errors, and allowed for safer and smoother transfers of patients to recovery. This experience reinforced my belief that continuous improvement, teamwork, and attention to systems are essential in medical, surgical nursing to maintain high standards of patient safety and care delivery.
Why are you interested in leaving your current position and pursuing this opportunity?
I am seeking this opportunity because I'm ready to grow professionally within an international healthcare environment that operates at a consistently high clinical and governance standard. In my current role as an operating theater nurse, I have gained strong experience managing complex surgical cases, high-pressure emergencies, and strict safety requirements. While I value the experience and responsibilities I currently hold, I feel prepared to take the next step in my career. My motivation is not to leave my role because of dissatisfaction, but to expand my clinical exposure and work within a broader multidisciplinary system that emphasizes evidence-based practice, advanced technology, and structured clinical governance. I want to apply the skills I have developed, such as precise surgical preparation, scrub nursing for complex procedures, accurate documentation, and strict adherence to safety protocols, within a setting that aligns with international best practices. In my current position, I have managed demanding workloads across multiple operating rooms while maintaining zero tolerance for errors in handovers, counts, and documentation. I'm now looking for an environment where I can continue to deliver safe, high-quality patient care while developing as a more versatile, internationally trained medical surgical nurse. This opportunity represents a natural and well-considered progression in my professional journey.
Why did you leave your last job?
I left my previous role because I wanted to develop as a specialist nurse and expand my clinical scope. In the cardiology department, I gained valuable experience caring for high-acuity patients, managing heavy workloads, and responding quickly to emergencies. That environment strengthened my assessment skills, monitoring abilities, and decision-making under pressure. However, I recognized that to progress professionally, I needed to build strong technical and perioperative competencies. Transitioning from a ward-based role to the operating theater was a deliberate and well-planned decision. To prepare for this shift, I completed my post-basic BSc in nursing and obtained BLS and ACLS certifications, ensuring I had the clinical knowledge and emergency skills required for a surgical setting. This move allowed me to combine my cardiology background with advanced medical surgical skills. I now manage complex surgical cases in a multi-theater environment and assist in high-risk procedures such as neurosurgeries. The transition has strengthened my ability to provide continuous, safety-focused care from preoperative preparation through intraoperative support and postoperative handover. Overall, leaving my previous role was a strategic step that helped me become a more skilled, confident, and well-rounded medical surgical nurse.
What is your management style?
I would describe my management style as collaborative, structured, and detail-oriented. I believe effective management in a medical surgical environment depends on teamwork, clear communication, and strict attention to safety at every stage of patient care. My focus is on creating a well-coordinated team where everyone understands their role and the patient's needs. In the operating theater, I lead by example. For complex procedures, I initiate the WHO's surgical safety checklist and ensure that surgeons, anesthetists, and nursing staff share the same critical information before the procedure begins. This approach promotes accountability and prevents errors. Time management between cases is a key challenge in perioperative care. I address this by delegating tasks clearly and planning ahead, so preparation for the next case begins while the current procedure is being completed. While efficiency is important, I never compromise on infection control or safety protocols. I measure effective management through accurate documentation, seamless handovers, and smooth patient transitions. By maintaining organized theater records and using structured communication tools such as ISBAR, I create an environment of respect, responsibility, and patient-centered care, even during high-pressure situations.
What are you looking for in a new role?
In a new role, I'm looking for an environment that places patient safety, clinical excellence, and teamwork at the center of care. I want to work in a medical, surgical setting where evidence-based practice, structured communication, and clear clinical governance are part of everyday work, not just policies on paper. I am seeking a role that allows me to fully utilize my perioperative skills while continuing to grow professionally. This includes exposure to a wide range of surgical procedures, modern equipment, and clearly defined protocols that support safe and efficient patient care. I value working within a multidisciplinary team where nurses' input is respected and collaboration is encouraged. Equally important to me is professional development. I am looking for an organization that supports ongoing learning, skills development, and opportunities for progression into advanced practice or leadership roles. I enjoy mentoring junior nurses and contributing positively to team culture and quality improvement initiatives. Overall, I'm looking for a role where I can deliver consistent, high-quality, patient-centered care while developing as a confident, skilled medical, surgical nurse within a high-standard healthcare system.
Tell me about your typical working day.
A typical working day for me begins with a thorough handover, where I review the operating list, patient details, and any special requirements or risks. I check that consent forms, investigations, and preoperative preparations are complete, and I ensure that all necessary instruments, implants, and equipment are available and sterile before the first case begins. During surgery, I work as a scrub nurse, maintaining strict aseptic technique, anticipating the surgeon's needs, and ensuring accurate instrument and sponge counts. I actively participate in the WHO surgical safety checklist and maintain clear communication with the surgical and anesthetic teams throughout the procedure. Patient safety and attention to detail remain my top priorities at all times. Between cases, I help coordinate room turnover by delegating tasks, preparing for the next procedure, and checking that documentation and counts are completed correctly. I also support junior staff and assist with problem solving during busy or emergency situations. At the end of each case, I complete detailed documentation and provide a structured handover to the recovery team using ISBAR, highlighting key intraoperative events and postoperative care needs. My day ends with ensuring the theater is ready for the next shift, maintaining continuity, safety, and efficiency in patient care.
Tell me about your strengths and weakness.
My key strengths are my attention to detail, clinical expertise, and ability to stay calm under pressure. In the operating theater, I am meticulous with sterile technique, surgical counts, and safety protocols, which helps prevent errors and ensures smooth procedures. I am also proactive, anticipating the surgeon's needs and supporting the team to work efficiently. My calm and composed nature allows me to handle high-pressure situations, such as emergency surgeries, without compromising patient safety or team coordination. Another strength is my commitment to teamwork and patient-centered care. I communicate clearly with colleagues, mentor junior nurses, and ensure patients feel informed and safe throughout their surgical journey. As for a weakness, I sometimes find it challenging to delegate tasks because I'm so focused on maintaining high standards. Early in my career, I would take on too much responsibility myself to ensure everything was perfect. I have since worked on this by trusting my colleagues' skills, clearly assigning tasks, and providing guidance without micromanaging, which has improved both efficiency and team morale. Overall, my strengths help me deliver safe, high-quality care, and I am continuously working to turn my weaknesses into opportunities for growth.
Can you give an example that shows you are a strong team player?
I demonstrate teamwork every day in the operating theater, where patient safety depends on clear communication and coordinated efforts. For example, during a complex neurosurgery, I worked closely with a surgeon, anesthetist, and other nurses to ensure everything ran smoothly. I prepared all instruments in advance, double-checked the sterile setup, and actively communicated updates throughout the procedure. When unexpected changes arose, such as a delay in equipment or a sudden emergency, I quickly coordinated with my colleagues, delegated tasks, and supported them without hesitation. I also mentor junior nurses, helping them understand procedures and safety protocols, which strengthens the overall team performance. Being a team player means anticipating the needs of others, sharing responsibility, and maintaining calm under pressure. My approach ensures the surgery proceeds efficiently, patients are safe, and the whole team feels supported and respected.
How do you stay updated with nursing practices and standards?
I stay updated with nursing practices and standards through a combination of formal education, professional reading, and active participation in clinical development. I regularly review the latest guidelines from organizations such as WHO and National Health Authority, as well as evidence-based journals related to surgical nursing and patient safety. This helps me ensure that my practice aligns with current global standards. I also attend workshops, webinars, and training sessions whenever possible, such as updates on infection control, advanced perioperative procedures, or patient-centered care strategies. These opportunities allow me to learn new techniques and improve my clinical judgment. In addition, I participate in peer discussions and clinical audits within my workplace. Reviewing cases, reflecting on outcomes, and learning from colleagues' experiences helps me identify areas for improvement in my own practice. By combining formal learning, self-directed study, and practical reflection, I make sure my skills and knowledge remain current. This ensures that I can provide safe, efficient, and high-quality care in fast-paced medical, surgical, and operating theater environments.
How do you cope with stress and maintain resilience in a high-pressure environment?
In a high-pressure environment like the operating theater, I cope with stress by staying organized, focused, and prioritizing patient safety above all. I break down complex tasks into manageable steps and follow structured protocols, such as the WHO Surgical Safety Checklist and ISBAR communication, which helps reduce errors and keeps me calm under pressure. I also rely on teamwork, communicating clearly with colleagues, delegating appropriately, and supporting each other during busy or emergency situations. Knowing that the whole team is coordinated and prepared allows me to stay composed and confident, even when unexpected events occur. Outside of work, I maintain resilience through healthy habits such as regular exercise, mindfulness, and keeping a balanced work-life routine. This helps me recharge mentally, so I can stay alert and focused during long or stressful shifts. Ultimately, my approach combines practical planning, strong team communication, and self-care, which allows me to deliver safe, high-quality care consistently while maintaining my own well-being in demanding medical, surgical environments.
How do you handle conflict in the workplace?
When conflicts arise in the workplace, I handle them calmly and professionally, keeping patient safety and team effectiveness as my priority. I first try to understand the perspectives of everyone involved and identify the root cause of the disagreement. Clear, respectful communication is key. I focus on discussing the issue objectively without letting emotions take over. For example, in the operating theater, there was a situation where there was a disagreement between team members about task allocation during a busy shift. I listened to both sides, clarified responsibilities based on each person's skills, and suggested a plan that allowed the surgery to proceed smoothly without compromising patient safety. By focusing on collaboration rather than blame, the conflict was resolved quickly, and the team continued working efficiently. I also believe in preventative measures. Regular team briefings, clear communication, and mutual respect help reduce misunderstandings. Overall, I handle conflict by staying calm, promoting teamwork, and keeping the focus on achieving the best patient outcomes.